Health, as defined by the World Health Organization, means complete physical, mental, and social well-being, and not just the absence of disease. Health is an important human right and worldwide social goal. For many people, health is not just about physical health. Health includes the social, emotional, and cultural well-being of their community. Health and well-being for Aboriginal people is linked to kingship, spirituality, language, self-determination, and connection to country. It is well known that health is strongly influenced, positively and negatively, by the social determinants. These are the social and environmental conditions in which we live. This means a person's health and well-being is dependent on non-medical factors such as their housing, education level, employment, and income. This is the same for diabetes. A person's risk of diabetes and diabetes outcome is largely influenced by the social and environmental conditions in which they live. To improve the rates and burden of diabetes and overall health and well-being in the Northern Territory, the social determinants of health must be addressed. This booklet and presentation was developed by the Northern Territory Diabetes Network. Thank you to the members of the network and working group for their contribution to this project. Let's first explore what diabetes is. Diabetes is a condition where the body cannot maintain healthy levels of blood glucose or sugar due to an inability to make enough or make good use of a hormone called insulin. There are three main types of diabetes. This includes type 1 diabetes, type 2 diabetes, and gestational diabetes. All types can be complex and can require daily care to prevent complications developing. Type 2 diabetes is the most common, accounting for 85% of all diabetes. Type 2 diabetes is often associated with lifestyle factors and genetic and family-related risk factors. Type 2 diabetes can be prevented or delayed. Risk factors for type 2 diabetes are ethnicity, family history, obesity, an inactive lifestyle, discrimination, and socio-economic factors. Some people have higher risk of developing type 2 diabetes. This includes Aboriginal and Torres Strait Islander people and people of Southeast Asian and Indian descent. However, it is well known that the underlying socio-economic factors increase the risk of a person developing type 2 diabetes. This includes low socio-economic status, overcrowding housing, unemployment, food insecurity, and remoteness, as well as the impacts of colonisation. In Australia, Aboriginal and Torres Strait Islander people are more affected by these socio-economic factors and therefore face a greater risk of diabetes. Diabetes can affect the whole body. If diabetes is not well managed, blood glucose or sugar levels can become too high or too low. These can both cause serious complications and can affect a person's quality of life. Complications from diabetes include kidney disease, heart disease, foot problems, amputation, and blindness. It is important that people with diabetes understand their condition and how to treat and manage it. This can include healthy food, physical activity, and medications. Many different health professionals are involved in the care of people with diabetes, and regular health checks are needed to prevent and monitor for complications. Type 2 diabetes used to be seen mostly in middle-aged or older adults. Now it's found in children and young people, especially among young Aboriginal and Torres Strait Islander people. The rate of type 2 diabetes among Aboriginal and Torres Strait Islander youth is 24 times higher than that of non-Indigenous youth. Children and young people with type 2 diabetes can face serious complications earlier, have a poorer response to treatment, and have poorer health outcomes and reduced life expectancy. They can also need intensive support from healthcare teams. There can be strong links to diabetes between generations. Children are at higher risk of developing type 2 diabetes if there is a family history of diabetes. If a woman has diabetes during her pregnancy, the risk of her child developing type 2 diabetes increases. This may occur at a younger age and have some serious complications. Diabetes during pregnancy also increases the risk of babies developing obesity, high blood pressure, and/or high blood glucose later in life. Women with diabetes during pregnancy can have healthy babies. Good planning, education, careful management, and closer monitoring are needed to lower the risk for their child. The rates of type 2 diabetes in the Northern Territory are higher than other Australian states and territories. The burden among the remote Aboriginal populations in the Northern Territory is among the highest in the world. Research published in 2022 shows that 1 in 3 Aboriginal adults in remote Northern Territory are living with type 2 diabetes. Rates have increased substantially in the last 15 years and are continuing to increase. The age of onset in the Northern Territory is relatively young, with high rates of type 2 diabetes seen among 30 to 59 years old, and the rates of diabetes among people aged 15 to 24 increased by 97% between 2014 and 2021. This includes significant increases in young women being diagnosed with diabetes prior to pregnancy. As mentioned earlier, the social determinants of health are the social and environmental factors that influences a person's health. This can either promote good health or lead to poorer health outcomes. The determinants that lead to poorer health, including increased diabetes risk and poorer diabetes outcomes, include low income, insecure employment, low levels of education, food insecurity, intergenerational trauma, racism, overcrowded housing, poor living conditions, and reduced access to healthcare and social supports. Approximately 25 to 30% of the health gap between Northern Territory Aboriginal and non-Aboriginal people may be explained by the socio-economic disadvantage. Let's explore the social determinants of health in relation to diabetes. Overcrowding of households in Aboriginal communities is a large contributor to poor physical and mental health. Factors include limited access to basic facilities for washing, food storage and cooking, and heating and cooling. Access to power, refrigeration, and cooking facilities allows for food to be stored and cooked at home. This means families can store fresh food, cook healthy meals, and reduce the need for takeaway food. Many households in Aboriginal communities are overcrowded. In 2015, 53% of Aboriginal Territorians reported living in an overcrowded household, compared to 8.7% of non-Aboriginal Territorians. 59% of Aboriginal Territorians in remote areas live this way, compared to 31% in urban and regional areas. It is important to continue the work being done to improve housing in communities to improve physical and mental health. Education is a powerful tool to achieve better health and social outcomes. Attaining a higher year of school education can decrease health-related risks and improve health literacy. Health literacy is a person's ability to understand, use, and access health information and services. Studies from around the world show that higher a mother's level of education, the better the health outcomes for her children. It is also important for young people to have good physical, mental, social, and emotional well-being in order to go to school and learn well. Sickness, stress, food insecurity, and unstable housing are some factors that contribute to children missing school. In the Northern Territory in 2019, 30% of Aboriginal Territorians aged 20 to 24 years reported that they have attained Year 12 or equivalent, or Certificate 2 or above, compared with 89% of non-Aboriginal Territorians. As the level of education increases, the employment gap between Aboriginal and non-Aboriginal people reduces. Just like education, Employment provides important benefits for the health, social and emotional well-being of individuals. Unemployment has a negative impact on mental health and the rates of stress-related and chronic diseases like diabetes. Not only does unemployment negatively affect health, but poor health can affect employment. Adults with poor physical or mental health have a higher chance of poor job performance, more sick days, periods of unemployment, and lower likelihood of re-employment. Research has shown a strong link between socioeconomic status and rates of mortality, meaning death, or morbidity, meaning illness and disease. In 2018, 37% of Aboriginal Territorians of working age were employed, compared with 86% for non-Aboriginal Territorians. Education and employment are linked. Education leads to more employment opportunities and a higher income over time. This empowers individuals with more choices as they are able to better meet the needs of their family. This leads to an improved socioeconomic status and better physical, mental, and emotional well-being. When talking about health, it is important to recognize and acknowledge the impact of cultural determinants of health for Aboriginal people. Culture is central to the health and well-being of Aboriginal people. Stronger connections to culture contribute to stronger health outcomes. The cultural determinants of health include connections to culture, relationships with country, connections to family, kingship and communities, spirituality and language. Preventing diabetes is an important goal in improving the health and quality of life of Aboriginal Territorians, now and for future generations. Addressing the social determinants of health can reduce the number of people developing type 2 diabetes. It can also improve health outcomes and the quality of life for those with type 2 diabetes. Influencing social and environmental factors can be addressed through improved housing and overcrowding, increased employment opportunities, better education outcomes, food security and access to clean water, prevention of obesity, and opportunities for active living. Preventing and addressing obesity and diabetes requires agencies to work together, including sports and recreation, planning and infrastructure, local councils, education, health, and non-government organizations. A collective approach to addressing the social determinants can best support communities to design health-promoting environments and opportunities. To prevent diabetes and support people living with diabetes in the Northern Territory to live well, our focus for the future is addressing social and emotional well-being, increasing awareness about intergenerational diabetes, and promoting community-led design of prevention and health promotion strategies. Making communities healthier needs action from all agencies, organizations, businesses, and communities. Here are some examples of how you can make your community healthier. Promote drinking water and healthy takeaway options in shops. Be active every day. Run community or school gardens and cooking sessions. Improve housing availability and households for safe food preparation and storage. Provide and promote parklands and playgrounds for outdoor activities. Promote cultural practices such as ceremonial dancing as a form of exercise and access to traditional foods to hunt and gather. For more information to address the social determinants of health in relation to diabetes and obesity, please see the National Diabetes Strategy, the National Obesity Strategy, and the National Preventative Health Strategy. For further information, please contact the Northern Territory Diabetes Network via the Prevention and Wellbeing Unit at Northern Territory Health. Thank you for listening to our presentation.